আসসালামু আলাইকুম দর্শক, আমি আজকে আপনাদের সামনে শেয়ার করব আমেরিকার প্রেসিডেন্ট ডোনাল্ড ট্রাম্পের করোনা পজিটিভ ধরা পড়েছে এবং তার ওয়াইফেরও পজিটিভ ধরা পড়েছে। সো আমি এখন শেয়ার করব আমেরিকার একটি স্বনামধন্য নিউজ, সিবিএস নিউজের যে ব্রেকিং নিউজটা আমি আপনাদের সাথে শেয়ার করব। আশা করি আপনারা আমার এই চ্যানেলটির সাথে থাকবেন। দর্শক, আমেরিকার ইলেকশনের মাত্র কয়েক সপ্তাহ বাকি এবং আজই ধরা পড়ল প্রেসিডেন্ট ট্রাম্প এবং ওনার ওয়াইফের কোভিড পজিটিভ। সো আমরা দেখব আগামীতে উনি কিভাবে ইলেকশন পরিচালনা করে। সো আমার সাথেই থাকুন।
We're getting some breaking news, so we want to take you now to our local CBS coverage.
Trump have tested positive for COVID-19. President Trump himself tweeted the news just over an hour ago. This comes hours after a top Trump aide tested positive for coronavirus. And CBS 2's Jeff Vaughn is live in the newsroom now with more on this breaking story. Jeff.
Pat, good evening to you. This is obviously stunning news 1 month before the election, and from a president who has dismissed wearing masks and who continues to hold those massive political rallies across the country in violation of many local health orders. Just before 10 o'clock our time tonight, the president sent out this tweet. Tonight, Flotus and I tested positive for COVID-19. We will begin our quarantine and recovery process immediately. We will get through this together. The president's announcement comes just hours after Hope Hicks tested positive for COVID-19. She is one of the president's most trusted advisors and is by his side, we're told, day in and day out. We're told that Hicks also flew with President Trump on Air Force One to Tuesday's presidential debate in Ohio. Trump, by the way, is 74 years old, putting him at a higher risk for serious complications from the virus, which has killed more than 200,000 people nationwide. It is unclear, however, what the president and the first lady's quarantine process will look like. The CDC does recommend a 14-day quarantine after the latest known exposure to someone who has tested positive for COVID-19. And late tonight, the president's White House physician issued this statement. The president and the first lady are both well at this time, and they plan to remain within the White House. I expect the president to continue carrying out his duties without disruption while recovering. Again, breaking news, President Trump and First Lady Melania Trump have tested positive for coronavirus and have begun the quarantine process. That is the latest tonight from the newsroom. I'm Jeff Vaughn. Pat, back to you.
All right, thanks for that, Jeff. And our live team coverage continues now. We have Dr. Tom Yadigar. He's with us live. He's a medical director of the ICU at Providence Cedars-Sinai Tarzana Medical Center, and the doctor oversees all the COVID patients at that hospital. Doctor, thanks so much for joining us tonight. First off, I want to ask you, given the president's age and his weight, would you consider him to be at a higher risk for serious complications from the virus?
Yes, unfortunately, people over the age of 60 to 65 and people with underlying heart or lung conditions, as well as people with diabetes and obesity, are at a higher risk for the adverse events from COVID-19.
But of course, doctor, we can't say for sure that that would happen, correct?
No, that's the thing that makes it so unpredictable is that, I've taken care of 95-year-old patients who look like they are totally fine and there's nothing wrong with them. And then I've taken care of 30-year-olds that are otherwise healthy that are struggling and fighting for their lives. So that's the one thing about this virus that makes it so unpredictable.
Well, if President Trump and the First Lady were tested today and they found out tonight that they are positive, how important is contact tracing and how important is quarantining right now?
It's vitally important. What we want to do is cut down the rate of transmission as much as possible. So it's very important for anyone that's been in contact with them, as well as with, I believe Hope Hicks, who was the initial person to quarantine themselves and to get themselves tested. The last thing we want is for this virus to be passed on from one person to another.
And finally, tonight, doctor, how critical are the coming days for the president and the first lady? Because if the White House doctor says they're feeling fine right now, does that mean they won't see any severe symptoms later?
Well, for most patients, after they have contracted the virus, it's usually within the first 3 to 5 days that they present with symptoms. And that's the other thing that makes this virus so unpredictable is the range of symptoms is so variable. Patients could be asymptomatic or could have a severe case of the flu and end up with pneumonia and fighting for their lives.
Doctor, Are there any medications right now? The president often talks about, I'm not going to, well, hydroxychloroquine, he talks about that, but he also says that they have been very successful with other treatments for COVID-19. Do you agree that there are other drugs that people are being treated with right now that can be successful?
You know, unfortunately, hydroxychloroquine, we had so much faith in it in the first few months, but in terms of hospitalized patients, we did not see any benefit, and the randomized trials also confirmed that there wasn't any benefit. So we're not using hydroxychloroquine. There are a lot of outpatient trials that are underway, but in terms of outpatient medical management, I know that some patients are taking inhaled budesonide, which is a steroid, but other than that, there isn't anything that's standard of care at this time.
All right, so the best thing, I guess, is for the president to quarantine and just take care of his health.
Yeah, for the first 3 to 5 days, we tell patients that, you know, essentially you're treating it essentially as a flu, where if patients are having symptoms such as fever, body aches, muscle aches, then, you know, we want them to stay well hydrated, as well as they can take Tylenol or non-steroidal medications to suppress the fever and suppress the body aches. Usually after about 3 to 5 days, if you're not getting better, that's when we start getting a little bit more invasive and aggressive in terms of getting chest x-rays as well as blood tests to make sure that there isn't a pneumonia going on or an inflammatory process, which is what usually gets started around the second week, usually about 5 to 7 days after the symptom onset. And there are other medications that we do use for those, for the anti-inflammatory process.
All right, well, I think we can all say that we hope that this is a very, very mild case for the president and the First Lady. Dr. Tom Yadigar from Providence Cedars-Sinai Tarzana Medical Center, thank you so much for joining us at this late moment.
দর্শক ধন্যবাদ আমার এই ভিডিওটি দেখার জন্য। আপনারা আমার সাথেই থাকবেন, ইউএস বাংলা ব্লগের সাথেই থাকবেন। আপনাদের সবাইকে ধন্যবাদ। আসসালামু আলাইকুম।